Up an hour? It's 12 o'clock. Council. All right. That's what I was saying, yeah. Is Hogan back there? I think Hogan is back there. I didn't see him. I will look for him. He's not. Is he in the building? Yeah, that'd be great. I was wondering why it's a little dark today. Huh?
One of the properties that come offered, we have to pull it because this property on Parksbury sold in June.
So, Chief, it's who's joining us here?
Chief Russell's going to be the operator of this show today.
Okay.
Somewhere, so
I think Hogan and Council Hogan and Peniel are coming. Yeah.
brought the subject matter expert.
Good. Good.
I'm here from Wall Street.
He's even in his uniform today. Man, we're up to something good here. So, welcome to Public Safety Committee meeting. We are here to discuss our services, city services facilitated by Liberty Resources, and to just examine the item, examine the progress, and to see what has worked and what has not worked, what are some of the success and challenges, and to just also see the data in terms of the services that have been delivered, and again, and the success of those. I'm joined by my fellow councilors, Councilor Peniauer, Nave, and I think there's more on their way coming, hopefully. So I'm also joined by our SPD team, Chief Russin, Chief Schaaf, and I think a member of Liberty Resource team. Do we have anybody from Liberty Resource or no? Okay. So just walk us through, Chief, where we are, and just review for the viewers what this project is about, and go from there.
So we partnered with, thank you for having me, Mark Russ, Syracuse Police, I'll start there. So we partnered with Liberty Resources several years ago to have in the field mobile crisis counselors to assist the police department on a wide variety of calls. That was really step one in what is going to be a several year program to start to divert a series of calls away from police, fire, and EMS and into mobile crisis counselor hands, and then also into a mental health pipeline, if you will. So that was the first iteration of it. We're still using the program significantly. That's why this was on the council agenda. And I can give you a little overview, 30,000-foot view, if you'd like, about what that looks like in the city of Syracuse. On this first page, the black border on it, it's right there, Counselor.
You got one, Marty?
Yeah, I got it.
In the top left corner, you'll see that 911 calls entered as either mental, suicidal, or status check that go into the city of into the 911 center. The 911 center has done a great job pulling this data together with the county team to help us figure out when and where we should be placing some of our resources. So what we know is that when the calls are coming in, the highest peak was what we decided to be the pilot hours was from 11 a.m. to 7 p.m. That's the bottom greenish blue line there. The blue line above it is all the calls that are actually coming in to the 911 center. So although we have a significant amount of calls that are being captured from 11 a.m. to 7 p.m. during some of the pilot program hours. We know that there's more calls to take. We are averaging somewhere between 300 and 400 calls per month. So 3,500 to 4,500 calls per year that are being called into the 911 center for mental, suicidal, or status check that we believe there's some level of substance use disorder, mental health, or other crisis that's being involved. So it's a significant problem. That's why we're dumping significant resources in at the county level, city level, local level. If you flip to the next page, it says timing and aftermath of the calls. In the bottom left corner, and I think this is important from a philosophical standpoint, bottom left corner, it shows call acuity change. And you see folks that are in our highest level of crisis, so they have a high level of acuity, and then the percentage of what is actually they're being downgraded to by the end of the call. So for folks that start at a high acuity, they get downgraded almost 80% of the time to a low percentage point. The whole goal is to stabilize in the community and minimize the amount of times that we actually have to transport someone. And there's a wide variety of methodology. You could use mental health law. You could use voluntary consent. If it's involuntary, it'd be more towards the mental health law. But the whole goal is to stabilize in the community and then do follow-up and support with that individual so they become more regularly stabilized. If you flip to the overview of persons in crisis calls, it's a bar graph on the top right-hand corner. In the top right-hand corner, you can see 386 of the calls. Let me back up a little bit. Some of the numbers are not going to match up because the paperwork that I'm giving you here is just for person in crisis coded calls. And so the coding matters. You could have something that's coded as a suicidal complaint. You could have something that's coded as a person in crisis complaint. And that's one of the challenges with this type of information is that there's going to be different types of coding. But specifically as it relates to persons in crisis calls that's coming to the 911 center or 988, you can see in the top bar graph, 386 were stabilized in the community. And that's the goal, is divert away from police, fire, EMS if appropriate, and then ultimately stabilize and follow up with the person in the community. On the long form, on the legal form, this is just for Liberty Resources. I know that's primarily why we're here today, but just for Liberty Resources, there's been in the middle box, on the small middle box, there's 316 call-outs year to date from SPD to Liberty Resources. So when SPD is calling for, as we go through this transition, where we're trying to intercept calls at the 911 center and get them diverted before police, fire, or EMS gets involved. When police do get involved, we still have a significant reliance on our mobile crisis providers. And one of those mobile crisis providers is Liberty Resources. But we also are working with St. Joseph's Hospital, Helio Health. There's a lot of folks that we lean into for this service. Addressing the scope of this problem, you need to have many different resources at your disposal for the different types of crises that we are responding to as a community, but then specifically as SPD. If you flip back 2 pages to this referral location, it's the bottom right-hand corner, referral location. The one in your left hand, sir.
Right here.
Yep. If you look at that referral location, you'll see Crisis Connect, Helio, Liberty, Hotline, Access, Housing Assistance, VA 988, St. Joseph's Mental. You will see all of the resources that are there. And as I've talked about this before in front of this group, we're trying to build this fourth lever, where all of these resources, when appropriate and where appropriate, we're tapping into those resources. That's how we start to divert some of those 3,500 to 4,500 calls through the 911 center, intercepting those calls and getting them diverted into the other professionals' hands.
All of these calls and numbers are for a year of service or how long service?
January 1 to October 2024. But the numbers for the totals, ma'am, are fairly stable. 350 to 450 per month is a fairly stable number.
Chief, how many of those individuals are repetitive callers?
I don't think we have the data yet. I might be wrong, so I can follow up with you. What I can tell you anecdotally is that there are a lot. A lot of the calls are repetitive. As I've come in front of the council, and we've termed it the Friendly Faces program. It's really the mental health referral program that Captain Jim Milana is a partner with the county and several agencies. They will talk about folks that we, from SPD's perspective or 911's perspective, there's multiple phone calls that are coming in from this person. Sometimes we'll see this person degrade over time. Like we just reviewed a case where the person just moved here. And then there's been 34 calls with this one person since June. So now we need to have a significant intervention, and that's what that team's job is to do. Now the person has moved back out of the community, and we make those notifications to the other county that this person had just moved to. So there is some continuity of information which enhances the continuity of care.
Were you there 2 weeks ago? 1000 First North Street with a 36-year-old man,
Yes.
I won't mention his name, was holding someone hostage, and then the SWAT team came in. So were this program there?
If appropriate, they'll be there. So
It wasn't appropriate then because the
Exactly.
SWAT team was there, but the man could have been, and I know he had prior arrest, but it could have been a mental health crisis. So what I'm saying is that perhaps they should have been there. You know, this man had some mental, personal issues, and the SWAT team was trying to get him out. He could have committed suicide, and I think he was in fear of seeing the SWAT team. He eventually went out, but I'm believing that there should have been a crisis situation. It was a crisis situation where they should have been there trying to talk to him as well. When we have these crisis situations with someone being held hostage, we had it on North State Street. Maybe we need these services there at the same time. I think it warrants it. I think, in my opinion, it should be automatic when someone is holding himself up with gunfire and you get the SWAT team involved. There's got to be another way. Thankfully, he got out.
Well, yeah, when you say thankfully he got out very intentionally.
Right.
So when we deploy our SWAT team and you see the men and women that are in the uniforms with the long guns,
Right.
that's only one small component of the SWAT team.
Okay.
Our crisis negotiators come out as well too.
Okay.
And they have special training that bridges the gap between tactics and negotiations with a person that's in crisis, and could be for a wide variety of reasons why they're.
Sure.
So he didn't just come out on his own. He came out of his own free will after our crisis negotiators and the men and women wearing the uniform were able to bridge a gap with him and get him to come out. Right. I agree with you. We will call out Liberty Resources. Where there will be times where we will call out Liberty Resources to have them involved. But when there is a threat to life, we use our personnel. And the reason he came out is because our personnel are really, really good at what they do.
You are very professional.
Yeah,
I
appreciate
saw
that.
when I was there and you told people to move back. And I think it was very harmful that people thought this was a joke, that they were taking videos of it. And it wasn't. A very serious matter.
And we will, and we have used, if we feel as though there's an appropriate lane for crisis, because I've worked on calls before where I can think of one in particular where a gentleman was standing up on a building.
Right.
And we had St. Joe's come right out. We've had cases very similar to what you're talking about where Liberty Resources will come out and they'll come into the command post with us and they will work hand in hand with us. Because sometimes they give us a perspective that we otherwise don't have. They'll give us a theme or a way to build rapport, make contact, all of these things. So we will absolutely use them on a resource. But at the same time, I don't want to minimize the great work that the hostage negotiators.
Right,
And
absolutely.
with that same line of conversation, Liberty Resources may not be adequate in training to handle something like, to put them in a situation where it can be harmful.
And I'm sorry, it's very collaborative in the command post. This is what we have, this is what we know. People will start to look at what's the background. Is this a known quantity for us? Is this someone that we've dealt with in the past? Have we seen this person at a hospital over the last several days? All of that intelligence gets fed into the decision-making process.
Deputy Mayor?
Sharon Owens, Deputy Mayor, just to reiterate, we want to ensure we are not sending civilians in a potentially dangerous situation. So SPD does a wonderful job of assessing, and we're even taking it the step before they're deployed to triaging it at the 911 center, because there are times when they won't even be deployed to the scene. It will be an outreach team. But if they have to show up, it's because there may be potential danger. So we want to secure the scene
Absolutely.
first.
They did an excellent job in evacuating all the tenants that day. It was very good. Very good.
The goal, been very fortunate to work in this organization where I've had some autonomy to make these decisions, where the goal is to prevent those calls from ever happening. Sure. The only way to do that, though, is to have more collaboration. You break down the silos from this organization to the next organization, and really everybody in the community has been working very well together. You have Helio, you have Liberty, you have St. Joe's, you have the VA. There's so many different resources that are working with the city through a contract, or the county through a contract, or this person lives at the rescue mission, or this person lives at Catholic Charities. All of these folks, the more you can understand what that person is going through in the moment, the less likely the catastrophic issues happen on the back end.
With all these numbers, Chief, what factor, or at least do we know how many of these individuals are involved in homelessness?
I was at the coalition meeting last Monday, and the numbers are staggering. And it's very difficult to measure, because it could be a person who's housed today that becomes deregulated and then is unhoused the next day. A lot of times we are seeing folks that are intentionally choosing not to live in a facility because they don't want to, but we're also seeing a lot of folks that are in for a week and then back out. So in terms of the percentage, I'm not sure that there is an accurate measure that I have with the data that I have. Do I think that it's a large percentage, an alarming percentage? Yes, I do, but that's anecdotal. I don't have any data that I could point to say these are all the unhoused individuals.
What about the criminal side of things in terms of people that are, back and forth with the law? Is there any correlation at all?
A lot of the cases that we are working on right now are quality of life related crimes. There's significant problems to the community, but at the same time, there's an underlying issue that we're trying to deal with. And all of the programs that we have set up have been in the spirit of fixing the root cause. Not to say that we won't deal with the criminal side of it, because at some point we have to deal with the criminal side of it. The goal is deal with the root cause before it becomes criminal in nature. But there are some folks that we have had. There's one individual that we've been dealing with for a long time where every day he would flip over every garbage can in the city of Syracuse. At some point, I have to deal with that. I mean, it's cost tens of thousands of dollars to clean up. So at some point, I have to. But the goal is not to get this person incarcerated. The goal is to get this person help so they can reintegrate back into the community, so this is no longer a problem for anyone.
Now, with that, it's a lot of literature out there in terms of, mental health and, jail system. And I think it would be interesting to see, those folks that repeatedly call, is there a correlation between that? And I don't know what level of analysis that would take for you to look at it, but I think that may be a helpful information as we continue to provide these services. What's the page? Okay, the overview of person in crisis call, the 386, right? I guess I'm trying to understand what constitute crisis, because is it when a person, like the one last week, is that what constitute a crisis, or what kind of metrics do you use to designate or at least label what is crisis?
There's high, medium, and low in terms of the acuity of what the crisis looks like. But that's beyond my expertise. In terms of what that is, I don't know, I have Jen here, I don't know if you can provide a response, or we can get you a response in terms of how do you categorize it? Because when we look at crisis as law enforcement, it's really more of a binary decision. Is this person in such a crisis that they need further intervention, and then what does that intervention look like, or do they not? And I think that's really the reason that having mental health providers embedded with the police department is important. You know, I can tell you the difference between a burglary and a robbery. There's people who train their lifetime to tell you the difference between high, medium, and low acuity. And that's really where I think that socially we should be growing, is that there's people that can run diagnostics much better than I can on mental health crisis calls, and they should be making those diagnostic decisions.
Can I make a comment?
Yes, sir.
Because of the domino effect. People live in fear. They see it in their neighborhoods. I get complaints in the business districts, North Salina Street. We've seen what's happened in Westcott Street. People can no longer continue to be in business if people have these problems or whatever issues they have. Go in their business, threaten them, disrupting them. What are they going to do? I mean, are they going to just move up? If people go shop downtown and disrupt the people come towards them, maybe attack them, this does not look good for our city. People are living and shopping in fear, and they were going to avoid, because we have an issue that this has to be addressed. But please look at the other side, how it's affecting poor innocent people in our society. You want to shop downtown, in the comments I hear, don't go there. Neighborhoods, don't go there. And it's a sad fact of reality, though. So we want to emphasize all this care, and like we do on North Salina Street. But then when I have to hear a complaint from one business owner on North Salina Street and about Helio Health or any other business, look what they're doing to my business. This has to be addressed, or leaving trash. These have to be addressed as well.
Yeah, I agree, and I think that's where the partnership has to be, because you do get to a point, and there's a lot of cases where we have, as a team, come together and said, this is to a point that we can no longer not go down the mental health route, and there is a level of we have to make this a criminal issue.
All right.
And then the criminal issue still needs to be dealt with through the lens of fixing the root cause, or you're going to be right back dealing with the same problem over and over and over again. But I agree with you 100%, because and that's really where I think the patrol captains do just a remarkable job meeting with business owners and figuring out what are the times, the places, the people that we need to give special attention to. But I agree with you 100%.
Thank you.
Yes, sir.
What's your name, ma'am? Jennifer? You had something to add?
Hi, Jen Parmalee. I'm the Deputy Commissioner for the Department of Children and Family Services for Onondaga County, and I just wanted to share that we can get you our acuity scale. What's been really helpful, Liberty Resources was kind of the group that came together to really help us understand for a mental health crisis what we look at a low, middle, and a high level. And so I just wanted to share that we have the access to that, and we can get that to you through Mark. And of course, any questions you have related to that, we can provide.
That would be wonderful. The other piece is, Chief, is when we talk about, trying to make sure that these individuals do not become repetitive in what they're helping them, not bring them to a space where they are able to be stable, right? Have you had conversation with these organizations that are a sort of respite for them to see, because it is just as frustrating to the service providers, to 911, to people who are constantly, doing the same thing over and over and seem like they're not getting any breaks. What are some of the mechanisms in place to try to keep these individuals from experiencing the same thing Is there employment? Is there housing? What mechanism help keep them from getting into the street and getting to these spaces?
I think some of the programs that we're working on collaboratively with the county and the city, and the way that we're looking at our like the opioid settlement dollars with the new SKIP program, really, there's a lot of service providers, and the more communication that happens, I'm not sure that it's a service deficit that's the problem. I think it's a continuity area of improvement, sharing of a central database, sharing of information, and you know, there's a lot of laws that prohibit the sharing of this information. Now, the PD has the ability to share information. It's a little bit more public than a medical record, but I think that there's services. It's how do we break down some of the barriers? How do we get this information out to folks? Who's doing the follow-up? How do we look at our contracts, and what do those contracts provide us on the back end? And then I really think, you know, from my perspective, there's some of that analysis that could be done. Is where are your gaps at that point?
And I will add, you know, that I think, and I may be wrong, but policies and procedures of mental health not always align with what we constitute as a need in the community, because there are certain things that they just can't do.
Yeah.
And,
I will also add the dilemma and the struggle we have is that people have the right to deny services.
that's what I'm saying, exactly.
And denying a service is not a crime, but then this is when we have to start to determine, is their denial of services affecting how they're interacting with the rest of the community? And then we have to make a decision about, are they impeding upon the safety and welfare of the larger community? But part of the dilemma not only is the coordination of services, the protections that we all have for sharing information that should be in place to protect our information, but people have the right to refuse services. And we send our outreach teams out to engage individuals. I don't want any, nope, I don't want it. And they have the right to do that. What they don't have the right to do is infringe upon the penal code that we have in the quality of life.
And also, you know, to your point, there are a certain amount of days that you can have somebody, you know, institutionalized or under some kind of care.
Right.
That day is just policy, it's procedure.
There are crisis intervention facilities you can send people in, but there's a very finite number of days that they can be there without a doctor's prescription or note to say they need to be there, and have the right to leave, whether they're stabilized or not.
Want to, yes.
A lot of this was born out of the Deputy Mayor, Mike Collins, Jen Parmalee. We've been working together for a very, very long period of time. And really this started during that police reform era, where it's, if SPD is getting tapped into, or the 911 center is getting tapped into for 350 to 450 calls per month, then how do we divert out of that system, right? That's, and this is I've said it, you know, before publicly to you all, I say again, this is what building of the fourth lever looks like. Instead of just calling police and fire and EMS, you get, what is the other response to, you know, 3,500 to 4,000 calls per year. It's a substantial number of calls that some of them are repetitive to your counselor. Some of them there's frustration with the business owners. You know, this is a very, very complex issue. And I think the growth that we've had in the last 2 to 4 years is significant. It's significant because there's been significant amount of time, and we're diverting and tapping into these resources in a totally new way. But it's going to take us years to get this.
What about the hospital capacity? How does that impact impact all this work?
I have had a meeting with every hospital in the community, and all of them are saying the same thing. Resources are stretched thin. The ER is stretched even thinner, and this is a really big problem for us, and we're not able to provide the care because of X, Y, or Z, right? Because of all these resources. So the more that you can stabilize someone in the community with a community-based service provider, the better off I think the whole system is. But the hospitals definitely play a huge part in this. I just had a meeting last week with St. Joe's, and it's a quarterly meeting where we're constantly trying to improve the processes that we have to make it efficient for everybody, because they need the resources as much as anybody.
I want to ask you, a lot of these people, do they have their own personal physicians? Do some of them have their own personal physicians where you're able to talk with their personal physicians or go in their history?
That would be beyond our scope in terms of,
Okay.
now they could provide information to us where, there might be a service provider that has worked with this individual, but it's very generic, it's very global in the way that they talk to us. Because a lot of times we don't need the finite details of that's not what we're there for.
Okay.
We're saying, hey, is this person degrading, or are they escalating their behavior?
There are HIPAA violations. I wanted to mention that too.
Yes, and that is part of the continuity of care issue, is that the consistency of medical care. We had a woman in City Hall just last week in a total crisis mode that we ended up calling the ambulance for. And she was on medication. She had stopped taking her medication. So the continuity of care, not because the doctors have not been there and been assigned, it's just if a person is homeless or if a person is housing vulnerable, how are they going to maintain the continuity of their appointments, of who their counselor is supposed to be? It is so many different variables that add up into the individual that we saw sleeping outside of a church or on a doorstep or down by
And
the
it does
rescue mission.
happen because it takes one family, one personal tragedy can change a person's life. I know that from experience. It takes one tragedy where you're not at all responsible. Depression, anxiety, fear, and people who will pull you into the wrong. It's wrong. We had a gentleman come into was looking for me, and he comes into Common Council and keeps on repetitive talking to me. And at one point he says to me, well, I want you to know, Counselor, I'm not crazy. Well, this is where I have to get local enforcement involved, because I have to be concerned, not just for my safety, but the safety maybe other people as well, or his personal safety.
Yeah, and that is where you all, as counselors, the police department, mayor's office, all of us have to balance. We're understanding the dynamic of what's affecting the lives of these individuals, and at the same time, we have to hear business people, hear residents, and hear individuals who are visiting our city, who are concerned one way or the other about
Right.
individuals that they see.
They are. I'm in the
Yeah.
North Science Street Business District, and some of the owners have told me
Yeah.
about certain things that they can't deal with.
Yeah, I mean, my hairdresser is on North Salina and Catawba, and I love going to see her all the time up there.
Right.
And she locks her door now.
They do.
So-
I go to Cut on the Edge barber shop. I asked them what's going
Right.
on. They tell me, hey, someone took my garbage container and trashed my outside my business.
She hasn't left because her constituents like me like the fact that I can just drive down North Salina and see her, and she runs a wonderful business. But she has had to change her business model.
Yeah, it's
Anything else, Chief?
No, appreciate the questions. It's an important conversation and got a lot of support, so I appreciate it.
So I guess this is the last question I got for you. So talk to us about, as a summary, talk to us about your win and talk to us about your frustration.
I think the win is that it's easy to get impatient, and I think that people have been patient but have been very energetic at the same time. We've got a really strong team with, the PD is just one small component of this. We've got a lot of stakeholders that are community-based organizations, the city, the council, Chief Cecil, the deputy mayor, the mayor. They have all supported this. And sometimes it's easy to get impatient. So I really appreciate people's patience as we fix the problem, but we're fixing it energetically, and we've got great people that are working on this issue, and we are making progress. That's the win, is we got people that care, and they know how to fix it, and they're doing their jobs.
And the fact that you're doing it from the root up, I think it's phenomenal.
Yeah, and the frustration of this is that you can't make these changes overnight. We have major problems that we're working on but we have timelines that I think are very appropriate for the problem. But everybody wants this fixed yesterday. This wasn't created overnight. It's not going to be fixed overnight. Now, at some point, I'm concerned people are going to lose their patience, and I'm going to be back at this table and saying, I promise you we're working as hard as we can, as fast as we can. Nobody's going to be more energetic than our teams that are put together, but people get impatient very quickly with this topic. And we need to remember how long it took us to get here and how long it's going to take to have reasonable, effective, constitutional solutions.
It's not easy, it's hard, but you have the ability to do the hard work. And we thank you.
With all of that, I want to thank you, Chief. I want to thank Deputy Mayor and all that have attended, my fellow councilors. Thank you so much. That will wrap it up for us. Thank you.
Thank you.
Thank you, Chief, always.
Great information.
Yeah. Well, not that I